Brace for a rise in dengue cases. The warning to Jamaicans this evening as the country moves to prevent a public health crisis in the aftermath of Hurricane Melissa. The health minister also indicated there are no reports of unusual outbreaks. Andrea Chisholm has the details.
The Ministry of Health so far received no unusual reports of outbreak of diseases in the wake of Hurricane Melissa.
Health Minister Dr. Christopher Tufton in Parliament on Tuesday amidst speculation of various diseases in Jamaica.
Surveillance team within the public health system have been actively monitoring health trends with special attention to waterborne and vector-borne illnesses that often emerge after such weather patterns.
Surveillance teams are monitoring health issues while paying keen attention to water and vector-borne diseases. For example, dengue.
We believe we will see an increase in the population of various types of mosquitoes for obvious reasons, and therefore the risk of the dengue virus spreading. We are deploying more vector workers throughout the country, but particularly to the impacted areas, some 700 temporary vector workers, in addition to our permanent workers, are being engaged. That process has commenced, and what we will see is a stepped up level of activity in terms of fogging. In fact, the ministry will continue its program of oiling of stagnant water in over 150 communities that have been targeted for this week, with over 500 communities expected to be treated over the next 2 weeks.
Through support from UNICEF, the ministry will get more thermal foggers, drum covers, and other vector control paraphernalia. Meanwhile, Dr. Christopher Tufton reiterated the damage to the Black River, Nowell Homes, Falmouth, Cornwall Regional, Savannah Lamar, St. Anne's Bay, and Bellevue hospitals.
Cornwall Regional has lost bed capacity of about 200 beds. Falmouth Hospital lost some 65% of its roof, severe damage to lab and radiology services. Savlamar with 65% damage to roof, along with other flooding damages and storm surge.
2 field hospitals have been established, one in Black River and another in Falmouth.
These field hospitals are not tents. They may be positioned as such, but they are full-fledged hospitals with operating theaters, pharmacy, blood bank, inpatient care, accident and emergency wards, and facilities for those who are serving the patients in those field hospitals. They have their own kitchen, desalination plant for water. It's a full self-contained facility which provides significant support to the people on the ground.
Andrea Chisholm, TVJ News.